Well, officials are still waiting for the coronavirus tests results of 114 South Africans who were recently repatriated from Wuhan, China. That happened over the weekend, you'll remember. The group is under quarantine just outside Polokwane, Limpopo. One of the South Africans has been in contact with eNCA reporter Sheryl Masigane. Here's that exclusive interaction.
It's still a waiting game for the South Africans who were trapped in Wuhan, China, and for their families. Their coronavirus test results aren't out yet, and for the next 3 weeks, they'll be monitored closely.
Yesterday, all these citizens were examined and were tested for COVID-19. We await the results.
The quarantined have little access to the outside world. This man, who is one of the repatriated, says they have settled in.
We had a challenge of financing the chargers because the military is only now, we are receiving word now that the military is only bringing back our bags now. I think they want to spray them with disinfectants and what. So it is only now that they are writing a message to say, listen, the bags have arrived. So we have settled in.
He says the group is worried about the stigma attached to the disease.
You know, I want to be honest with you and say most of the guys, especially who are residing in Limpopo, who are part of the quarantine, are very skeptical to talk to the media and other things. And none of them want to talk to them because of the stigma of the virus.
For now, those quarantined in Polokwane are the more fortunate ones. 4 South Africans were left behind in China after showing symptoms of the coronavirus. Sheryl Masigane, Johannesburg.
Well, as I was telling you, COVID-19 has been declared a national disaster by President Cyril Ramaphosa. That declaration came in on Sunday. Professor Cheryl Cohen is from the National Institute for Communicable Diseases and has become one of the frontline figures in just communicating about this virus and where it's going. Let's bring her in now via Skype to talk about where we are in dealing with the pandemic. Professor Cohen, a very good evening to you. Thank you for being on Nightline. So, do we still have enough time, and how much time do we have to stop this becoming a national disaster in the worst sense?
So good evening, and thank you for having me. You already gave in your introduction the current situation, which is that we do have 62 confirmed cases of coronavirus infection. Most of these are clearly imported cases from travelers who've come into the country from other countries, but as the Minister of Health mentioned, there are some of them being investigated as possible local transmission. Now we do know that the reason why we are following up on the contacts of all of these cases is because of the possibility that the virus could spread locally amongst people. So this is a a possibility that we were aware of, and as the Minister of Health also has announced, and the President, in fact, in his address on Sunday night, this phase really where we are seeing imported cases and we're trying to contain them is anticipated just to be the initial phase. And I think all people in the global scientific community would agree that every country in the world will move from the phase that we're currently in into the next phase, which will be where we start to see the virus spreading more widely in our communities. And it's really that which we have to be prepared for. And really what we're doing now is trying to identify the cases and slow the spread to give us time to prepare. But there's a lot of preparation that needs to be done. And I think that the President's speech really outlined all of the different sectors and how important it is that we all work together, no matter what sector in society you're involved in, to prepare for what will be an extremely exceptional event in our lifetimes and will affect all of us. And it's really not just the health sector, it's all aspects of the economy, it's the social impact as well.
Prof, are we able at this stage to predict what the peak of coronavirus or COVID-19 will be in South Africa? When we reach that point, what will be happening? Is it going to be like in Italy, for example, where they are reporting infections by the hundreds? Are we going to start to see a death toll which begins and then goes on to climb rapidly? What would the peak look like for us?
So there are a number of different what we call mathematical models which are being worked on right now, which are aiming to look at exactly this question, predicting different scenarios for South Africa and really trying to work out what numbers we might see in terms of infected individuals and severe cases, and also the timelines over which these evolve. And I think some of these models will be released into the public domain over the coming days. I think what's really important to note is that in all of these models, which are really our way of trying to predict what will happen in the future, there are important assumptions that we make. So we in terms of how the disease might progress. And what is important is that the interventions that are put in place to try and stop the epidemic can also really impact on the total numbers. And I think that the president announced really a comprehensive package of different interventions yesterday, which I think is really just the first line of interventions. He also mentioned there'll be a committee that will consider this and consider other interventions. So the measures such as closing the schools, such as social distancing, limiting large gatherings, all of these measures are really designed to reduce contact between people, because this virus spreads through contact between people, and try to blunt the curve and change the trajectory of the epidemic. So in our modeling and our scenario planning, we also need to incorporate the potential impact of these different epidemics. So at this time, I can't give you a firm number, but there are a number of groups really trying to work on the different scenarios for the country, and there are preliminary models that are being discussed.
The World Health Organization, of course, tonight holding one of its regular briefings on the COVID-19 pandemic, and again stressing the importance of testing, because not enough countries are testing as many people as they should. I know currently in South Africa we're not testing every single person in the country. Is that not where we need to go?
So I think, South Africa's really had a very well coordinated strategy on testing right from the start, really aiming to make sure that we are able to test the people who need to be tested, but that we don't, allow our systems to be overwhelmed by what we call the worried well, which are people who are worried about having the virus, but in terms of our understanding are not really at risk, and then could overwhelm our health system. So I think, currently the scenario that we see is that the cases we're seeing are really imported cases with possible limited local transmission around those cases. And so this is the group we're focusing our testing on, but we're not limiting our testing to that group. And that's really important for people to understand. We are also testing anybody who's admitted to hospital with pneumonia, even if they haven't traveled. If there's any concern about that pneumonia, if the doctors would at all like to test, we are inviting them and welcoming them also to test these pneumonias who haven't traveled. And so those people with severe respiratory infection, if we were to start seeing transmission in the community, we should identify it in that group. And in addition, we're testing on our routine surveillance programs in all the provinces, which are just designed to monitor respiratory disease. So for now, there's not a suggestion that the testing needs to be expanded more broadly. But that being said, we do constantly update our case definitions and broaden them as the situation evolves. So for now, we're really doing lots of testing, and you can see that's why we're picking up lots of cases. We're not at the stage yet where really everyone is at risk, and so we're not testing everyone, even if they haven't traveled or they haven't contacted a case, and they're not at any risk of really having contracted the infection. But those guidelines will evolve as the situation demands.
Very briefly, please, Prof, I want to ask you about the tracing of contacts. These are people who may have interacted with the people who carried COVID-19 into the country. The first few cases were that group that had traveled to Italy on a vacation. But in terms of the success rate from the work of these tracer units, realistically, is it fair to say that we cannot realistically find each and every single person who's been in contact with these 60-plus cases which we've confirmed so far?
So absolutely. I mean, you allude to the fact that it really is a massive task. I mean, the contact tracing on 60 people, and remembering that it's respiratory type contact. So that means a contact is defined as someone who's spent at least 15 minutes within 1 meter of the person. So there can be scenarios in a group setting where a large number of people could be exposed in a relatively short period of time. The teams are doing really well on the ground in terms of identifying contacts. I think think one thing we need to consider is that there is a lot of public awareness and also public anxiety about this illness. So very often, in fact, it's not only the tracer teams going out to identify the contacts, but more often than not, the contacts are also coming forward and presenting themselves because they want to be tested and they want to be monitored and they want to self-isolate and they want to do the responsible thing. And I think, the fact that people are engaging and really presenting themselves forward is making the contact tracing certainly facilitating and aiding the effort. However, it is intrinsically a difficult task, and I think there is a recognition, that all over the world, this is challenging, and there is a possibility, of course, that some contacts will be more difficult to track down or take a little bit more time to find. And I think it's this understanding that the challenges of tracking the contacts, as well as the ongoing situation with more and more people potentially presenting themselves, as we've seen each day, the new cases being diagnosed, which is really a result of the fact that there are a lot of cases of the virus outside South Africa. All of these, lead to the projection that at some point it will start to spread in our communities.
And lastly, then, Prof, I want to take you back to that briefing by the World Health Organization, worry being raised today about the spread of COVID-19 in countries with a high HIV prevalence rate. South Africa is one of those countries. Have we picked up any trend from the people who've been tested so far, either negative or positive for COVID-19, in terms of the virus and its spread among HIV-positive people in the country?
Yeah, so that's absolutely a really important question for South Africa. At this stage, there's not really conclusive information about HIV-infected individuals and how the virus will behave in this group, but we're using what we know about other respiratory diseases. We have a research protocol in place, and we're analyzing the data from the cases in South Africa, and we plan to, as the outbreak evolves, analyze the cases, firstly to see whether HIV-infected people are more at risk of severe disease, and also to see if there could be a potential different transmission to or from HIV-infected people. But it's really too early for any of the results of that to be available yet.
Professor Cheryl Cohen, always great to speak to you.